Hello to the BSN2 nursing students of MCNP, and I hope that you are doing good, safe, protected in this time of pandemic, and much more in this time of these calamities, heavy rains, floods, landslides everywhere. And as you can hear in my background, it's really raining hard. It's like resting for about 10 to 15 minutes as ulan ulit. Okay. So anyway, I'll, you have this recorded video lecture for um, supplement for supplementary aid for your review for your resources or materials in studying our subject in community health nursing 1 lecture. And our topic for this moment, or as I record this video lecture, is the Philippine healthcare delivery system. Okay, the Philippine healthcare delivery system, and let us start. So, the Philippine healthcare delivery system. In this series of video lectures, under the topic Philippine healthcare delivery system, we are going to study about national health status. Not really discussing it, but we'll try to relate it on what is happening right now or what happened for the last 7, 8 months, and components of the Philippine Healthcare Delivery System, or PHCDS. We have its goals and objectives, organizational structure of the DOH particularly, and the levels of healthcare facilities, and also the two-way referral system. This is presented in your LMS, but this one will be, as I said, uh, a supplement, okay, of what is the contents of your LMS. This is shared through a link, so if you want to subscribe, follow, or like the video, you may do so for you to be updated on what is being uploaded for your lectures in the YouTube channel that I created before I send the link in our LMS. Okay? Sorry for the background. So, I think it gets stronger. Kanina wala na yan. Okay, so first we have the related terms and concepts uh, supporting this healthcare delivery system topic. Okay, so components of the Philippine healthcare delivery system would be the first topic after this, but we'll try to discuss first different terms related. So when you say healthcare delivery system without the letter P, because P actually stands for Philippines or Philippine. So for healthcare delivery system, this is the totality of all policies and facilities, equipment, products, human resources, and services which address the health needs, problems, and concerns of the people. So, when you say totality of policies, facilities, equipment, products, and resources, etc., and this pertains to anything, everything, anyone, everyone, whether it's a facility, whether it's human resource, whether it's money, budget, um, anything that pertains to health, okay, and addresses the concerns of the people when it comes to health is healthcare delivery system of any country for that matter. Okay, and we say healthcare delivery system, it talks about the countrywide. Okay, not only regional, not only local, but usually it is countrywide, nationwide. Okay, country to country. Okay, and when you say healthcare delivery system, it's usually large, it is usually complex and multi-level, and usually there are here in the Philippines, not giving emphasis on the Philippines. When you say healthcare delivery system or the third world countries, then or before, There are usually four questions asked here. Who are served? One is who are served, and the other one is who provides a service. Where are the services given? And what is the focus of care? Okay, what is the focus of care? To answer the first one, usually the references would say only a few of the population is served by a healthcare delivery system, because there is a notion that you need to buy it. You need to pay out of your pocket when you want to avail the services of the health sector. Only a few can afford. Okay, we'll try to discuss more on this later on. Who provides services? Usually, of course, it's the professional ones, the healthcare professionals. Okay, healthcare professionals. Sorry. Then what? Where are the services given? Usually, in the hospital. Okay, most of the time, hospital clinics. Okay, but we are aware that there is what we call public health nursing. Usually, this caters the needs of the community people, okay, or outside the hospital setting. Then, what is the focus of care? Majority is curative in nature, treatment in nature. Okay, uh, although for the past years I have observed that um, emphasis is also given on the preventive and promotive aspect of care. Meron kasi tayong tinatawag na preventive care, promotive care. When you say preventive is care focused on prevention of diseases, illnesses, injuries, even deaths. When you say promotive is care which is focused on promotion of health, well-being. Okay, um, one is curative, or otherwise known as treatment care. Then fourth is rehabilitative care. This is usually happening after treatment of care, or even during the treatment of care. And, and with these questions and answers, we'll try to discuss the healthcare delivery system of the Philippines, and I can say that the answers given to these questions um, varies, or have can give you already different answers. Okay, so let's continue. So related terms again, we have the system, the word system. It's a set of interrelated and independent parts that form a complex whole. Okay? And of these parts can be viewed as a subsystem with its own set of interrelated and independent parts. Okay? So, medyo malalim, no? Medyo mapapa second or third read ka to understand. Okay? So, as I've mentioned earlier, this healthcare delivery system is a large, complex system. One, okay, taking in consideration we're talking about a whole country, uh, or and each in every country it has its Department of Health. For example, under department or the healthcare delivery system is divided into private, to public, and non-government organization, and each sector has its own subsystems. Okay, or making an analogy. Okay, you take a hospital, for example, we have the CBMC hospital. Okay, CBMC hospital is the healthcare delivery system. Okay, the whole of it, the complex of it, and you know that the hospital CBMC has different departments. So those are the subsystems, and in each department, different components uh, make up the department. It's like the Philippines, okay, or healthcare delivery system. Okay, in every healthcare delivery system, divided, there are subsystems, and every subsystem, there are components. Okay, halimbawa, in a department, there are nurses, there are doctors or the health professionals. You consider the equipment. Let's take, for example, the department as a facility. Okay, you have to allocate money for that, so merong budget dun. You have the processes on how to take care of that. patients in that department. So, ganun din sa Pilipinas, ganun din sa mga bansa, ganun mga proseso. Okay? And a lot more. Okay? So, parts and subparts interrelated with one another, meaning, for example, one department in a hospital to another department. For example, a ward to the laboratory, to the ER, to the imaging department. So, they work interrelatedly. So, ganun yung health system natin. And I know, you know the meaning of healthcare system actually. Uh, and one question that usually I ask here is, what can you say about the healthcare system in the Philippines? Okay, actually there would be a requirement for you in this topic. Okay? More of a research, uh, uh, what's this research requirement later on. Okay? Letter B, health system is the interrelated ways in which a country organizes available resources for the maintenance and improvement of the health of the citizens and communities. So from the word system, uh, it should be in place, it should be organized, it should be in a process, okay? It should be in a chart maybe or in a flow of activities, series of activities from the start until the end. Okay? Or sabihin mo na lang, um, let's make it simple again. Huh? When a patient comes in a hospital, okay, for admission maybe, for checkup, what is the flow? What is the system? Okay, kasama na ang other components of the healthcare system. Halimbawa, nandyan din is how will the patient pay for the bills? Are there what's this, insurances? Okay? How will the doctor take care of him or her? How will the nurses take care of him, of the patient? So yun yung sinasabing system. Okay? Is it really systematic o magulo? Okay? So, yun yung ating system and health system. And third, healthcare system, an organized plan of health services, healthcare delivery. Okay, from the word delivery is rendering healthcare services to the people. Okay, so in summary, when you say healthcare delivery system, it's like the first terminology that I give you during the second or third slide. Okay, is the network of health facilities and personnel. So everything. Okay, facilities, personnel, materials, money. Okay, which carries out the task of rendering healthcare to the people. So lahat sa buong bansa, ng isang bansa. Okay? That is your healthcare delivery system. And in the Philippines, kahit natanggalin mo yung word, yung name ng Philippines yan, no? Healthcare system is, again, is a complex set of organizations interacting to provide an array of health services. So, what are the major functions of the healthcare system? Okay, not only to make it specific in the Philippines. One is ensure equal access to basic health services. So, ensuring equal access, dapat every citizen, regardless of something, meaning regardless of the race, regardless of economic status, religion, color, dapat lahat sila may access sa basic health services. Then second, ensure formulation of national policies for proper division of labor and proper coordination of operations among the government agency jurisdictions. Okay, so the key word here or phrase here is formulation of policies. Okay, formulation of laws, of programs. Okay, that is for the good of the health of the citizen. And third, ensure implementation of the implementation nationwide or nationwide implementation of services regarding as public health goods. So it's not only formulation of the programs or projects, but how will they deliver it? How do they make the services accessible to the people? Okay. Then number four, plan and establish arrangements for the public health system to achieve economies of scale. Okay, so economies of scale usually pertains to how can you make it available for the citizen, um, or the citizens, considering the differences in economic status. Okay. Um, the number five, maintain a medium of regulations and standards to protect consumers and guide providers. So it's not only giving services to the citizens of a country, but also to protect the consumers and guide providers. Um, there are things that example is how to protect the consumer, no? And guide providers. They set also policies, rules and regulations. Or one example here is you, no, or us as a professional nurse, um, the consumers should be protected that a professional is really a professional. Okay, or um, this is to ensure that the people are getting the quality care that they are expected to have. Okay, that's number five. Okay, and whether it's a material, whether it's a medicine, a facility, or a healthcare professional for that matter. Okay? So, what are the characteristics of healthcare delivery system? The system should encompass the entire population on the basis of equality and responsibility. So, meaning again, the system referring to the healthcare system uh, should cover, should cater, should address the whole population. Okay, with the basis, with the consideration of equality and even equity, and knowing that this is a responsibility, that this is a duty. Okay? And you, my future nurses, are already included here, if I may say, as nursing students, but more when you become a licensed nurse, a professional nurse. It should include components from the health sectors and from the sectors whose interrelated actions contribute to health. So when you say healthcare system, it does not only mean the health sector, but the different sectors of the society, whether it's government or non-government organization or private institution, for as long as they can contribute to the implementation of a project, of a program, and that's it. Uh, they should be included. Okay? They will work uh, in partnership, as a team, as a system. Okay? And third, the essential elements of primary health care should be delivered as the first point of contact between the individuals and the health system. So later on, in the next topics to come, we are going to discuss what are these elements of primary health care. Um, Usually, these are the affordable services, the accessible services, acceptable services that a healthcare system should provide before um, the community people will go for higher level of healthcare. Just like um, the tertiary hospitals, the expensive hospitals, the bigger ones, the special hospitals. So, bago yun, dun muna dapat sa um, first point of contact na kumbaga dadaan sila dapat, no, from the smallest facility or the simplest facility, referred to second one, third, then babalik sila from third, second, first. But it depends on the patient actually, because what happens is if the patient can really avail going straight ahead to the uh, big hospital, to a specialized hospital or specialist person, they can do it. Uh, And but what is meant here is it covers, the health system covers every care possible from the simplest one, no, from a first point of contact of care until the highest level of facility or care na pwede pong makuha ng isang uh, pasyente or kliyente. The other level of system should support, okay, from the first point of contact, ibig sabihin the other levels, the higher levels, na kung saan pupunta po yung uh, citizen or yung tao, yung kliyente, should also provide aforementioned essential elements on a continuing basis. So, dapat may continuous care. May further management basing from the first point of contact. Yeah. At intermediate levels, more complex problems should be dealt with more skilled and specialized care as well as logistics support. So, ibig sabihin ito, as a client, a patient goes from one lower level facility, lower level health system to the next levels, to the higher levels, dapat mas malawak yung sakop, yung specialty, yung technical expertise ng mga levels na yun. Okay? Ibig sabihin, for example, a tertiary hospital um, is better than the, the primary level facilities when it comes to services. Okay? And the last one here is the central level should coordinate all parts of the system and provide planning and management expertise, highly specialized care, teaching for specialized staff. So when you say central level, this is usually the central office in a country or in a region. Usually here in the Philippines, we have the DOH as a central level, of course, and it um, this encompasses every public health facility uh, for coordination, for proper implementation of all programs and projects. Okay? And the DOH as a central office has its regional offices assigned to the different areas representing the central office. Okay, so on DOH region, for example, DOH region 2, that is under the central office, not the local, okay? Not the local government of, for example, a province. So, um, later on, we are going to discuss this structure or different structures of the health sector, specifically here in the Philippines. Okay? So, that's in the introduction to our Philippine healthcare delivery system. Okay? The different terminologies, the different functions of healthcare system, and the characteristics of a healthcare delivery system, specifically here also in the Philippines. So see you in the next video lecture. Thank you.